Hi, I'm Jennifer Freeman. I'm a professor of toxicology in the School of Health Sciences at Purdue University. Lead poisoning occurs when someone is exposed to lead and they absorb a high amount into their body. There are concerns if someone's exposed to really high doses of lead. They might show anemia, they might have vomiting, they might have other adverse health outcomes that present if they're exposed to really high levels of lead. So in children that are exposed to levels of lead when it's detected at greater than 5 micrograms per deciliter in their blood, there are concerns that it might alter their developing central nervous system. And they might present with learning disabilities. They might have adverse health outcomes related to anemia. They might also have behavioral difficulties where they might have trouble paying attention in class. And so a lot of our focus today is just on understanding whether or not the children might be at a higher risk of higher lead exposure. Today, the most common sources of lead exposure in the United States occur in older homes. So if your home was built before 1978, there is concern that there might be lead in the paint that was used in the home. This further increases if your home's older than the 1950s because they used even higher levels of lead in paint at that point in time. There's also a concern due to the plumbing fixtures that might be used in your home. Those also might contain lead, and so that could present a risk where you might be able to find lead in your drinking water. So the best way to protect yourself is if you have a young child that's 6 years of age or younger, is to get their blood tested to figure out if they might have an elevated level of lead in their blood. Again, this is considered at any level that might be higher than 5 micrograms per deciliter. If they're found to have higher than 5 micrograms per deciliter in their blood, the action plan will determine how much is actually in their blood, and you can work with your clinician to figure out what the best approach is for that child. There's also resources that are available through most public health resources within your county that you can pursue to look into if you might be at risk for having higher lead exposure in your home. If your child does present with elevated blood lead levels, one of the things we're going to want to do is investigate what that source might be. And so that might entail testing the paint from your home to determine if there's lead in the paint in your house. It might also entail testing your tap water in your house to determine if that might be a source of lead exposure for you. Another way to help prevent lead exposure in children is just to ensure that they have a healthy diet, especially one that's high in iron, so that it will help to prevent anemia if they are having lead exposure, and high in calcium. Now, lead wants to go into your bones, and calcium will actually compete with lead to block it from entering your bones. As such, it will leave your body more, so this will help prevent to keep that lead in your body and help to decrease the amount of lead that a child would have within their body. And so it's highly recommended just to make sure your child is getting the essential nutrients so they can help to limit how much lead is being stored within their body. Here in Indiana, we have the Department of Health is running their Lead in Healthy Homes program, and you can see a lot of different resources that are available to residents of Indiana through finding out more about whether they might be at risk for lead exposure. Most states have very similar sorts of programs that they can start to pursue if anyone has questions on whether or not they might be at risk for higher lead exposure.